The battle over health care, the Obama administration pushing Congress to pass health care before the end of this year. But opposition to the president's at least trillion-dollar plan is rising. Many senators, including some Democrats, are pushing back and pushing back hard. That is the topic of tonight's face-off debate. Joining me now, two distinguished senators, Senator Orrin Hatch, Republican of Utah. Senator, good to have you with us.
Nice
and Senator Bernie Sanders, independent from Vermont. Bernie, good to have you with us. We appreciate it, Senator.
Good to be with you.
Let me turn first to the fact that a bipartisan group in the Senate apparently closing on a compromise, which we had not heard until just now. Is it your sense, Senator Sanders, that that is the case?
I really don't know. That's in the Finance Committee. I think Senator Hatch may know more than I do.
All right, Senator Hatch.
Well, I don't know. I'd be surprised if they can put together a program that could be supported by Republicans, because they're pushing for, you know, more taxes, more government, and more spending. And I just don't see how you solve the problem of a $2.5 trillion current bill by adding another $1.5 to $2.5 trillion more. But I know they've had a very difficult time because of that government plan approach.
Well, I'm not quite sure where Senator Hatch is coming up with those numbers. What I do know is it concerns me less whether we do it today or tomorrow or a year from now. What's most important is that we do it right. And Lou, we have a major crisis in this country, and it's not only that tens of millions of people are uninsured or underinsured. We've got over 18,000 people every single year die. They die because they don't get to a doctor when they should. We got 1 million people this year who are going to go bankrupt because of the very, very high cost of health care. So I think doing nothing is not an option, but my main point is we've got to get it right. That's much more important whether it's done tomorrow, next week, or 4 months from now.
Senator Hatch, your reaction to that?
Well, I think we do have to get it right, but I don't think getting it right is expanding the federal government. They want to now set up a board of 5 people, or a panel of 5 people, nameless, faceless bureaucrats to determine how to ration health care, because that's the only way they're going to save money the way they're going. Otherwise, we're moving right straight to everything the Democrats are asking for, at least the liberal Democrats are asking for, would lead us to a single-payer system, or in other words, socialized medicine.
Well, wow. First of all, a single-payer system is not socialized medicine. Medicare is a single-payer system. And I would argue that most Americans feel a lot better about Medicare than they do about private health insurance companies who throw them off of health care if they have a pre-existing condition or if they got sick the preceding year, whose CEOs have enormous salaries and compensation packages, whose administrative costs. You know, Lou, we have got to ask ourselves why in the United States we are spending almost twice as much as any other major country on earth, and our health care outcomes in most cases are not as good. And
part of it is because of government run. The Medicare system is $39 trillion in unfunded debt. Now we're going to turn the rest of our health care system over to the federal government. Not on my watch. You're not going to.
That's just not accurate. I think when anyone will tell you no, it's not accurate. Medicare, you know, if you're looking at the average person out there, their health insurance costs have doubled in recent years. What we're looking at is 1,300 private health insurance companies who have thousands of plans. In the last few years, the last couple of decades, what we have seen for every new doctor that's come on board, we need doctors, we have 25 healthcare bureaucrats. And people all over this country know how hard it is to get the health insurance companies to pay them what they're supposed to be paying.
And the worst health care bureaucrats that we have are the government health care bureaucrats.
I don't think so.
Are running this system into the ground. And to be honest with you, anybody who believes that the federal government is going to do better than the private health insurance competitive system is wrong. Now, let me just make one other point. We have 300 million people in this country. But they claim 47 million are not covered by health insurance. Now, let's just be honest about it. An awful lot of those people are people who could afford it but won't get it. Some qualify for the CHIP bill, or some qualify for Medicaid right now. Now what they want to do is move into a Medicaid expansion where they move more and more people into Medicaid when we're having a rough time paying for it now, and doctors don't even want to take Medicaid patients because of the way the federal government is handling it. Look, Bernie, I have a lot of respect for you, but come on, you know the doggone federal government is half the problem here.
Well, is that right? Well, then you go back and you tell veterans in this country that we should disband the Veterans Administration, which is 100% government run. Is that
well,
your suggestion?
I'm not telling them that. I admit
well, it's
that
a
there are
government,
things...
wait a minute. That's a government-run program.
Well,
Do you
there
want
are
to
things...
disband Medicare?
There are things government can do. I don't think they're doing it as well as they should do. But to throw over the whole private sector approach that is competitive, to throw it over so that we can have a bunch of bureaucrats, nameless, faceless bureaucrats, get in between your doctor and you, it just isn't right.
First of all, nobody is talking about that. What people are talking about
I'm talking about it.
Well, but no one is talking about a government-run healthcare system. We're talking about...
Sure they are.
No, they're not. They're talking about a public option.
What do you call the public plan? What do you call that?
A public option that will compete and give people the choice of whether they want a public plan or a private plan. Why are you afraid of that? If the private plans are so much better, people will go into the private plans. If the public plans are more cost-effective, more reasonable, people prefer a Medicare-type program, they'll go into that. Why are you afraid of the competition?
Not afraid at all. It's just that we know that there would be unfair competition because the federal government has unlimited funds to be able to carry on whatever it wants to carry on, and it wouldn't take long. Well, the companies have to pay taxes. They have to meet certain state and federal standards. They got all kinds of other things they have to do, but they can do it better than the government.
This is a level playing field, and I think it's interesting that the health insurance people who are spending $1 million a day lobbying Congress, putting huge amounts of money into campaign contributions, are afraid of that competition. I think that the American people are sick and tired of the private health insurance companies who have been ripping them off for years, and they want to see some competition.
Well, Bernie, why don't you and I work on solving some of the private health insurance problems? I admit there are some that exist, but they don't exist nearly as much as the federal government problems. And federal government control would just run this whole system right into the ground.
We're going to have to leave it awaiting the outcome of the Sanders-Hatch resolution. And we appreciate you both being with us.
Thank you,
Senator Orrin Hatch,
nice
Senator Bernie Sanders.
Lou.
Thank you, gentlemen. Up next.